Professor Azreen Syazril bin Adnan. I'm from MSU Medical Center, Shah Alam. I'm the consultant physician and nephrologist. Today we're going to talk about novel coronavirus from Wuhan, which is popularly known as 2019 novel coronavirus, which was first detected in Wuhan province of China. This type of new strain of coronavirus has affected many people globally, and it is causing a lot of mortality. It is transmitted by droplets. Cough or sneezing is the commonest way of transmission, and some have found out that it can be also be transmitted by skin to skin, by touch only. Patients who presented with this problem, usually they have got these upper respiratory tract infection symptoms such as sore throat, cough and fever. These type of patients, you need to avoid from getting in touch with them. If possible, try to wear masks and try to be away at least about 1 meter plus from these type of patients. And the complication of this disease condition, it can lead to respiratory failure, it can lead to multi-organ failure, and of course like kidney failure as well. This so forth will cause death. How do we prevent the transmission? Please make sure you wear masks in public area. Try to avoid in contact with people who look like having flu-like symptoms. And of course, try to wash your hands regularly after touching any person or anything which is related that may be infected with coronavirus. As such, I encourage people to go and see the nearest medical facility if you have got any symptoms of flu-like illness. Thank you.
Very interesting video, right? Okay, so let's watch another video. Sorry.
Assalamualaikum warahmatullahi wabarakatuh. Saya Profesor Azreen Syazril bin Adnan. Hari ini kita ada satu prosedur yang akan kita lakukan, iaitu renal biopsy. Renal biopsy adalah satu prosedur di mana kita mengambil cebisan tisu buah pinggang untuk mendiagnos punca kerosakan buah pinggang pada seseorang pesakit. Antara indikasinya adalah apabila terdapatnya darah dalam urin, protein dalam urin, dan juga kita tidak pasti mengapa paras kreatinin ataupun urea pesakit tersebut meningkat secara mendadak. Pada hari ini, kita ada seorang pesakit yang datang ke klinik saya dengan masalah darah dalam urin, protein dalam urin dan paras kreatinin yang semakin mendadak. Pesakit berumur 25 tahun. Jom. Apa biasa kan? Kita baru saja selesai memberikan bius setempat menggunakan ubat bius, dan seterusnya kita menunggu masa dalam kurang 5 minit untuk memastikan kesan ubat bius telah bertindak dan supaya prosedur renal biopsy boleh diteruskan. Selain daripada itu, sementara menunggu pesakit, kita melatih pesakit untuk bernafas secara normal, ataupun untuk memastikan prosedur boleh dilakukan dengan lancar, pesakit perlu menarik nafas dalam dan menahan nafas ketika biopsi dilakukan. Gerakan di hujung sebelah kanan di atas adalah tempat di mana jarum biopsi akan dimasukkan untuk tujuan prosedur tersebut. Jarum biopsi berfungsi dengan normal. Tahan nafas. Kita sudah selesai melakukan prosedur renal biopsy di mana 2 sampel telah diambil daripada pesakit dan keadaan pesakit normal, tiada masalah pendarahan berlaku selepas prosedur. Selepas ini, pesakit diperlukan untuk tidur secara lentang dalam masa 4 hingga 6 jam bagi memastikan kawasan yang telah kita lakukan biopsi tidak berlaku pendarahan yang mungkin menyebabkan komplikasi lain. Selain daripada itu, pesakit dinasihatkan untuk tidak mengangkat barangan yang berat selama 2 minggu dan mengelakkan daripada batuk dengan kuat ataupun masalah sembelit, kerana peningkatan dalam tekanan dalam intra-abdomen akan menyebabkan berlaku pendarahan kesan lepas prosedur biopsi. Sekian.
Okay, very interesting video. Thank you, Prof, for sharing this video with us. And okay, now that everyone is already excited, without further delay, I would like to invite Professor Dr. Azreen to take over the screen. So, Prof, the screen is yours.
Assalamualaikum warahmatullahi wabarakatuh. Thank you, Raina. Thank you for the invitation for tonight's bit of brief presentation, I would say, to share about internal medicine, nephrology, and in fact, with the Fauziah here, Obstetrics and Gynecology. Fauziah is here as well. Okay.
Hi, everyone.
Okay. What we are going to do tonight is basically I'm going to share with you some of the brief things about medicine, and I'm sure what I've understood that you may have already being exposed on the what is medicine is all about and how we go about in terms of pursuing medicine. But the thing which is different today, tonight, is that I'm going to share with the various career pathway in medicine, not only nephrology, but also we are going to talk about other areas as well. Okay, well, right. Okay, briefly, I will tell you how medicine evolved, and there is some, as you can see, there are a lot of Muslim scholars who has been pioneering medicine from the very beginning, and I would like to share why we choose medicine and who can do medicine, where to study, local graduates versus overseas graduates, and various specializations in medicine, not only nephrology. And later, of course, I will briefly mention about what nephrology is all about. I'm sure you have seen the videos. The first video is about COVID, which was published back in late 2019. There was a time when it was started off in Wuhan. And that is under the subspecialty of infectious disease in internal medicine, in which, as you understand now, when COVID is a pandemic, is a form of infectious disease, the infectious disease physician, which is under internal medicine, a subspecialty in internal medicine, they are very busy now managing the case on top of with the assistance of the public health specialists. The one that you see, the epidemiological data, the statistics are all being done by the public health people. But the one who is championing or leading the management of these patients are infectious disease specialists. I will briefly talk about nephrology, and I would like to highlight that in actual fact, becoming a doctor, not just becoming someone who is treating patients, you are also someone who also doing some lecturing that any other lecturers. On top of that, you may be involved as administrator. And I would like to share, if you are interested to pursue medicine in future, what are the challenges that will take place in the next 10 years as medical students, and what kind of challenges that you will face in the next 10 years as medical doctors. And briefly, probably, if you got time, we'll talk about medicine in future. I'm sure you have heard about Ibn Sina or Avicenna. He's the author of the Canon of Medicine, and he has been the medical textbook for centuries in Europe. Medicine started off in a philosophical way, and it covers, Ibn Sina cover general medicine, infectious disease, and of course neurology. Raiz Al-Razi, well known in Europe, also a Muslim, physician by practice and also a musician. He's utilizing his right lobe and left lobe, of course. He's also an artist, artistic. A founder of earliest hospital in the history of mankind, Hospital of Al-Dawlah. So these are all Muslim scholars, and they are the one who has been referred to by the European, by the Western people, and it becomes a Western medicine. And when you want to choose medicine, I strongly encourage that you find the facts right before deciding whether to pursue or not, because there are a lot of challenges out there, and there are a lot of things that you need to know between facts and myth of becoming doctors. And you need to know where to get information, and tonight's sharing is one of the method of knowing how to go about and to share the experience among us on how we can go about on pursuing this noble field. And you need to know the obstacles, and you need to test your tolerance as well. Being a doctor, as you can see now, people are talking about COVID. This is just a tip of iceberg. Okay, this is just a tip of iceberg. What you are hearing, what you are seeing, what you have listened, it's just a tip of iceberg. There's a lot of people out there who are having a lot of problems becoming doctors, facing all these issues of pandemic, and would say that we are in the state of emergency in either way, either in economy or in health. Tonight, we're fortunate because Fauziah is around. She'll be talking about obstetrics after this. I'll be talking about nephrology first, but why not? Maybe after this, we'll be talking about obstetrics first. Okay, here, Dr. Fauziah will be talking about obstetrics and gynecology.
Assalamualaikum warahmatullahi wabarakatuh. Hi Aina and all the participants tonight. Actually, this is very ad hoc. Prof. Azreen just mentioned to me about 5-10 minutes ago that I have to join your session tonight. So basically, my name is Dr. Fauziah Jummaat. I'm the obstetrician and gynecologist, now working in MSU Medical Center. So it's just a sharing session, I guess, for tonight. So basically, my area of the obstetric patients, all patients come to the clinic with antenatal care during delivery and also postpartum. And also, gynecologists, we have to take care of the patients related to a woman who has gynae problems. So, however, my area, my interest is actually more on obstetrics, which I took care of patients who are pregnant and also during delivery and also postpartum. We just had a delivery last 3, 4, 5 days with a twin pregnancy. This is our first twin pregnancy in MSU Medical Center. So we have a team here. Of course, in OT, operation theatre, definitely we have our anesthesiologist, okay, and also our team member, the scrub nurse, as well as the assistant during the operation. So these are also the team member of the labor room. We have the neonatologist and also anesthesiologist for the epidural in labor. For those coming for delivery, okay, all patients, of course, for delivery, it's not patient will have pain, labor pain. So our anesthesiologist will give an epidural to help the patients to reduce the pain during labor. So these are all our midwives. Okay, I guess this is our first delivery last 2 years, when we practiced delivery. I mean, we delivered a patient, first delivery in MSU. Okay, so this is actually our gynae operation last time when I was in Hospital University Science Malaysia in Kubang Keren. We had an operation of gynae operation. The most front on the left side is my most senior consultant, Prof. Shukri, and also on the right side is Dr. Haji Abdul Rahman, our senior consultant as well. we had an operation for a gynae patient. So during that time, we had an operation for, I couldn't remember how old is the patient, but it's an operation to remove, I guess, the uterus or the ovary. So before the procedure, we have to make sure that patient's in a good condition, stable, basically safe for the patient to go through with the operation. Because normally gynae patients, either way, if they don't have medical problems, but we have to check patients' blood investigations. We have to prepare pre-operatively that patient is stable before going for op. Okay. So, okay, now I can remember. This is basically the operation that we have done. We have gone through. If you all can see, this is actually the very huge part of the uterus, which the patient has some abnormalities here. And this is actually the part of the cervix. And if you can see over here, both sides, the ovary looks abnormal. Okay, the normal ovary doesn't look like this. Okay, so we have to take out both ovaries, both the fallopian tubes, okay, and also the uterus together with the cervix. So basically, this is the hysterectomy, total abdominal hysterectomy with bilateral, okay, both sides, salpingo, okay, oophorectomy. So these are the examples of the operation that we have done. We have gone through before this. Just to mention here that any operation prior to any surgery, okay, all doctors must get involved. So normally we have to do a pre-operative discussion with our colleague, especially all the gynecologists. If let's say we suspect of cancer of a patient, then we have to get our gynecologist to be in. Okay, that one is for pre-operative. And our anesthesiologist also is the most important person behind the operation, who will make sure that the patient will go through the operation, okay, to stabilize the patient during, before, and also after the operation. So, other than that, if let's say patients have abnormal blood parameters, normally we have to make sure that normally our physician will come in to make sure that the blood investigation is stable prior to the operation. So this is another example of the operation that we have done in Hospital University Sains Malaysia in 2018, whereby the patient has a very big ovarian mass here, okay, likely on the right side. Okay, on the right side, if you can see here, this is a normal uterus. Okay, and you can see this is the very bulky cervix. This is the normal ovary. So in this case, since we could find this abnormality, so I guess after we have discussed with our colleague, okay, prior to the operation, so patient also has to be counseled, okay, prior to the operation, the justification, okay, why do the doctor has to go in for hysterectomy, basically to remove all. So patients must be informed about the indications, about the risk, and also the benefit of any procedure that we are going to do to her or him. So, and patient has to give consent to the doctor prior to any procedure. That's how the ethics come in. When you want to become a doctor, then you have to make sure that you have to follow the ethics, okay? You have to respect your patients and respect your colleague. Okay, this is a very important thing. Okay, I think this is the same ovarian mass, I guess. So just to show you, in a normal adult woman, okay, you can see how big is the mass over here. And this is the normal, I guess, a slightly big also, the uterus, plus the cervix, and also the other side of the ovary, which is not that big compared to this cancerous of the ovary. Okay, okay, this is another talk that I'm going to give a talk in this 29th of January about cervical cancer. Maybe you can join me later. And we also have a talk last time. Maybe you can go through with the Facebook of MSU Medical Center of topic of obesity and dan risiko kepada kehamilan. So boleh tengoklah nanti. So I guess that's my part. Thank you, Prof. Azreen. It's very ad hoc, but thank you so much. If you all have any questions on the topic of obstetric and also gynecology, we can have a Q&A session later on. Thank you very much. So I give back to Prof. Azreen.
Okay. Okay, thank you very much to Fauziah for the brief introduction about obstetrics and gynecology. Basically, what you have seen just now is surgical based, and for internal medicine and nephrology, we are medical based, in which we don't do any surgery. Okay, coming back, why we choose medicine, why we pursue medicine? As you all understand, it's a noble career, and if you're Muslim, it's a fardu kifayah. Someone must have a knowledge about medicine, on how to cure people, and it makes you remember that there's something always more superior, more powerful. The creator, Allah is the creator, who gives you that you learn that there's something which is above, which is more superior, which is more powerful than a human being, and more opportunities to be successful in life and hereafter. It also depends on what is your objective. Everything is very much it's not right if you say that if you pursue medicine you become rich. No, I think that is very wrong. What I can say, me and my wife as doctors, we look for job satisfaction. When we heal people, it is something that money cannot buy. I have encountered so many situations in which I've got patients in ICU that I have treated for months, and when they come on stretchers and they go back walking back to the family, let it be within yourself that you feel that you have done something good to the family, to the patient. So it is something that money cannot buy. And of course, if you want to make it as a distinct, we can also consider yourself as a human engineer. And if you ask me, what do you mean? What is the definition of medicine? I would call it as something, I would define it as something which is everlasting. Up to this point, up to this juncture, even though I'm a professor, somebody who already like 20 years in medicine, I have to update myself. I have to read journals every day. I have to make sure that I'm up to date with the treatment, especially like now in the era of COVID, in which COVID presents in a various presentation. And we in nephrology, we know that other than the lung being affected in COVID infection, the kidney also fails. So we are actively involved in this kind of pandemic situation. Everybody's involved. It's a daily progressing field, okay? Doing medicine, it is not someone who is the best student, who is 4 letters, or someone who is with an IQ of 150 or something like that. It's not like that. If you want to do medicine, you must have good personal qualities. You must be someone who is hardworking enough, because it's a lifelong learning. You have to be disciplined, and you have to have a full of ethics. It's sad to say that some of people who graduated from medical school taking advantage of their position, doing something which is unethical. This is very, very wrong, and you should stop, and you should not encourage this kind of practice. And again, I would like to emphasize that it's your patient is the real textbook. I personally believe this is always the main thing that you have to always hold on as you go on practicing medicine, because whatever being described, what is being manifested, what is being shown by your patient is what is actually the real example of a clinical manifestation of your patient, not only just by referring to the textbook. So you can either be trained via this traditional or conventional curriculum, or integrated medical curriculum. What is meant by both this, between these two? It's no longer now conventional, if I would say. There's more of integrated medical curriculum, in which during your first year, you're being introduced on microbiology, the infection, the microbes, the parasites, the thing that can predispose to infection or disease condition. And you are being exposed to relate between this theory and this clinical practice. If you can observe now, even in the second year, medical students are already being exposed, seeing patients. So that is meant by integrating different kind of subjects. In medicine, you have got pathology, study of disease conditions. You have got microbiology. You have got biochemistry, you have got physiology, you have got anatomy, and of course, you can have some other additional things like epidemiology and statistics, medicine. So all these things are being blended, and this is why it's being called as integrated medical curriculum. So these are a few examples of university recognized in doing medicine. Okay, now is the thing that I wish to highlight in our talk tonight, is the various specialties in medicine. And nephrology, obstetrics is part of the specialties in medicine, or surgical based branch of medicine. So everybody follow the same path. Yeah? When you graduated from medical school, it is 5 years or 6 years medical program, you go to your housemanship, which is now 2 years. And after the housemanship, you go to your medical officership, which is again another 2 years. And now it is no longer a permanent post, it is a contract-based post, which is depending on how you perform, depending on your, various things, criteria will be used in terms of assessment. And once you manage to get your contract to become permanent, chances is very good that you can pursue your postgraduate programs. So this is where you choose your path. It is either a clinician or non-clinician. Non-clinician are those who are involved basically in universities as academician. So you can see here in this part is as anatomists, biochemists, physiologists, pharmacologists, immunologists, medical education, and statistic medicine. They are sometimes in the public health, they are involved here. So in terms of academic, they don't really much involved with managing patient or treating patients. They are involved actively in the educating students, medical students in their first year and second year. This is what we call as preclinical years. While for administrative, you can find these people who are hospital directors, state health directors, and of course the pegawai perubatan kesihatan. These are the people who are currently working, I think 24/7 and 31 days direct, because now it's COVID. So they are very much involved in, if there is a dengue outbreak, if there is COVID or any kind of infectious disease condition or any kind of medical emergencies, they are very much actively involved. And pegawai kesihatan daerah as well. These are all health officer. While clinicians, okay, we have medical base or surgical base. In medical base, we have got two separations between internal medicine, which is what is the topic being highlighted today. The title of the talk today is internal medicine. So under the branch of internal medicine, the specialties is internal medicine, okay, and this is for the pediatrics, for the kids, anything for patients below 12 years old covers under pediatric. For internal medicine, these are adult. Anybody who has identity card, 12 years old and above, are all under adulthood, are under internal medicine. So we have got adult neurology, pediatric neurology, nephrology, adult, pediatric nephrology. So neurology is about nerve, it's about the brain, about the spinal system. Nephrology is about kidneys. Gastroenterology is about your gut. Hepatology is about the liver. Dermatology is about the skin. Infectious disease is talking about AIDS, TB, COVID, all these things. Rheumatology is about the joint problems. Geriatrics are specifically about adult above 65 years old. This is all for adult. By 2040, we expect a lot of numbers of Malaysians will be under this category of patient. Oncology is about cancerous study. Endocrinology is about the glands, the glandular, okay. Cardiology is about heart. Hematology is about blood disorders. So you will find it similarly on the other hand here, on the other side, which is this is for the pediatric age group. While for surgical base, we have got general surgery, in which you know that if you got the common things that they do is for, in the case of appendix, they do surgery for appendicectomy. Falls under general surgery. Neurosurgery is for the brain surgery. I'm sure you have heard about Prof. Arman's last lecture. He was talking about reconstructive surgery. This is plastic surgery or reconstructive surgery. Orthopedic is about the bone. This is Dr. Fauziah's area. Obstetrics and gynecology. Ear, nose, and throat is about ENT. Pediatric surgery. Ophthalmology, okay, this is about eye. Vascular surgery is about the vessel, the repair of the vessel. And urology. Urology is about the kidney as well, but it is surgical based. They do the transplant, they do the removal of the kidney, and they handle the cases of stone and whatnot, prostate, etc. So of urology and nephrology, they are sort of like brothers and sisters, but urology is surgical based. Like myself, nephrology, I don't do surgery, but I take care of dialysis patient, I take care of autoimmune disorders of patient involving the kidney. So this is basically the various specialties in internal medicine. So let me talk briefly about nephrology. If you can imagine an organ that do the job of filtering the blood to make sure that the blood is under in a clean mode, maintaining the blood pressure, maintaining the electrolytes, maintaining the acid-base balance. These are all being done by the kidney. So it coming from the Greek word. It's a combined with the suffix of logy. It's a study of the kidney. Nephrons means the unit in the kidney. It's a specialty of medicine, and even in pediatric medicine, concerns about the study of kidneys, specifically study of the normal kidney function and kidney diseases. What are the subspecialties? Subspecialties. Okay, specialty is internal medicine. Subspecialty is nephrology. Subspecialty is general nephrology, internal nephrology, renal transplant, dialysis, peritoneal of GN. So these are another small branches in nephrology. So this is what actually is all about nephrology. Our kidney is special. Okay, this is basically the structure of the kidney. It comes by pairs, and if you ask me, can an individual survive with one single kidney? Yes. That's why people donate kidneys to someone who has end-stage renal failure, renal transplant. So your kidney comes in pairs, and there are two layers, which is the cortical part and the medullary part. So this is where all the glomerulus, the nephrons, resides. So there are about 1 million small units of nephrons in one kidney. Two kidneys, you got 2 million. You reach the top of the kidney function at the age of 25. After the age of 25, when you reach 26, 1 unit of this 1 million start degrading. So as I told you, we have got 1 million unit kidney in 1 million unit of nephrons in one kidney. Every year, after the age of 25, 1 nephron will die. 1 nephron of 1 million nephrons. So these nephrons, the glomerulus, everything will filter the blood, and urine will be going through the pelvic calyceal system, renal pelvis, and goes to the ureter and to the urethra and becomes the urine. So this is basically it's a very important organ which people sometimes unrealized about its function. It's not only to produce urine or the waste products, it also activates vitamin D, it maintains electrolytes and acid-base balance, it removes the toxic like the nitrogenous waste products like the urea. I'm sure you have heard about urea. Urea, if you go through, it can be a fertilizer basically. But this is not a fertilizer. What I'm referring to is a urea is a byproduct of the protein that you take, the fish, the meat, the chicken that you're eating, it being broken down, and it becomes the nitrogenous waste product, what we call as urea. And creatinine also is a byproduct, phosphate, and these are all being removed in the urine. It is also the site to produce the hormone, what we call as erythropoietin. That's why when you see someone with renal failure, they look pale. Why they look pale? Because they don't have enough red blood cell. Why? Because the hormone which is producing via the process of what we call as erythropoiesis, from the hormone of erythropoietin which is being produced in the kidney, is no longer there. Okay, and this patient usually when they got kidney impairment, they will become hypertensive. So it's basically a vicious cycle. When you got hypertension, you can get kidney impairment. When you got kidney impairment, you will worsen the hypertension. So basically, these are the interrelated kind of situation. So we heard about what are the risk factors of getting kidney impairment. People who are smoking, you smoke, you damage the kidney. Various cause of organ damages because of the smoking habit. This is gouty arthritis, a very classical presentation. Your first toe will be very painful because of uric acid deposition at this joint. So uric acid deposition here, imagine the uric acid deposits in the kidney, it predisposed to stone, renal stone. So that damages the kidney. And I have a young patient as early as 25 years old, getting end-stage renal failure, requiring dialysis 3 times a week because been taking painkillers. They got migraine, they got menstrual pain. They take painkillers for pain relief. So this will damage the kidney. Taking painkillers is not a good thing because it can damage your kidney. Hypertension can damage your kidney, and when you use these slimming pills as well. So these are the commonest non-conventional cause other than hypertension and diabetes that can give rise to kidney impairment, which is currently a very worrying trend which is happening. So in someone with kidney impairment, you will find all this kind of manifestation. They can have periorbital swelling as been described here. The periorbital is the region between the eyes, so you can see it's swollen. Okay, this is a classical presentation of a patient with nephritic or nephrotic syndrome. They usually become overloaded, means they've got a lot of fluids in their body. When they got excessive of fluids, they got enlarged heart. So why is this happening? Because the urine is no longer being produced there. So there's not much of urine being produced. There's too much of fluids in the body, intravascularly in the vessel. So they become overloaded, and they can have these swollen both lower limbs, in which if you press the skin, it will be dented. It will not be back to normal. And this is also a presentation of someone who has renal impairment with a diabetes, complicated. This is what we call as a diabetic ischemic disease. It is associated with peripheral vascular disease. So these conditions are the one that is giving rise to various problems. So here briefly, I want to show you what are the kidney functions. And when you become renal impairment, you got this hyperkalemia, the electrolytes becomes abnormal. So these are the treatments that we propose and we advocate to our patients when you got renal impairment. So basically in nephrology, we deal a lot with patients with chronic kidney disease, pre-dialysis, before they need dialysis, and when they become end-stage renal disease or ESRD, in which they either go for hemodialysis, kidney transplant, or peritoneal dialysis, or even conservative. When you reach, some patients reach at the age of 75, we feel like if you do the dialysis, the risk outweigh the benefit. So this is a situation of ethical issues here, whether you want to leave the patient alone or you want to intervene by giving some kind of a treatment like hemodialysis or peritoneal dialysis or even transplant. Our national guideline, anybody above 55 renal failure no longer eligible for kidney transplant. So this is just to show you a setup of a hemodialysis center, which is under a nephrologist care. This is to show you, this is a very beautiful setup. This is in Indonesia for information. It's recently being, this one, somewhere in Jakarta, I think. So you see the setup is beautiful, it's very conducive, but the real setup depends on some centers, they look a bit not that conducive, it depends, okay. So basically, when you got someone with renal failure, we subjected them to hemodialysis, in which we do hemodialysis at dialysis centers 3 times a week, every session 4 hours. And at home, there are people doing home hemodialysis. They do it at night, but this is very expensive treatment. You need to have a personal nurse to do this. Peritoneal dialysis is a form of a dialysis treatment also, but utilizing fluid. Yeah? This is an example of CCPD, continuous cycle of peritoneal dialysis, which done at night only for 6 to 8 hours. And this is manual CAPD, in which it is done 4 times a day at home. So these are the various form of dialysis treatment. These are some of the complications if you see that can be present in dialysis patient. They become very itchy, generalized body, a lot of stretch marks. Why is this happening? It's because of the urea. Like I mentioned to you just now, urea is the nitrogenous waste product, which actually is accumulated, which is supposed to be excreted out in the urine, but it's not being excreted out because the kidney fails, and it accumulates in the body, in the vessel, and it is also accumulating underneath the skin, causing all these scratch marks. So this is the hemodialysis treatment. This is the dialyzer, in which the blood is being cleansed. okay, the blood from the patient being attached to the fistula, in which I think the recent last lecture Prof Arman showed you about fistula, arteriovenous fistula. So we work hand in hand with a plastic surgeon, and they created the AV fistula here, and the cannulation from the needle to the patient's vein, and the blood goes to the machine and being dialyzed here, and the clean blood after being filtered here being returned back as a clean blood. This is basically in replacement of the failed kidney. So being a nephrologist, you are involved with plastic surgeon like Prof Arman, you're involved with Dr. Fauziah in obstetric cases. Like recently we have got a case of hypertension with twin pregnancies we managed together. Being a nephrologist, we also involved in ICU, in which we need to dialyze patient in ICU for, like maybe 24 hours dialysis treatment. And being nephrologist also, we have to manage cases like hypertension, diabetes, stroke patients, heart problems, which is interrelated. When you got fluid overload, the kidney fails, it will cause, what do you call that? The heart will be enlarged, like the chest x-ray that I showed you earlier on. So I'm coming to the point that I want to share with you all is that what are the challenges if you think of pursuing medicine? Getting a place is always a problem. It's limited. And even in fact, after you graduated, chances of waiting for you to be employed as house officer also a challenge. So these are the things that you have to bear in mind. And then, of course, you need to know how to survive, because after your SPM, you have to go to your A-level or IB or matriculation. Then that will take about one year or 2 years. Then you go to your medical school training, 5 years or even 6 years. Then after that, you go to your postgraduate training. Before you go to your postgraduate training, you have to go for your MO-ship or housemanship. So these are all the challenges which I think you have to be prepared mentally, physically, emotionally. If you ask me which one is good, individual or group study, in medical school, you have to make sure that you have got a good group support in terms of getting yourself self-motivated, and of course your friends to motivate you. You need to be very good in terms of organizing, planning and targeting, because there are so many things to learn in medicine. It is dynamic. Whatever they have learned in medical school for the last 20 years is no longer applicable now. So these are the things that probably is very much challenging. And when you become a house officer, you have to become someone who is very much disciplined, and you have to practice medicine in a continuous way, learning from others, and of course you have to self-learn as well. And as you become a medical officer, you have to train your juniors, and you have got various line of people above you, like the specialists, the consultants. And this is the time where you start considering what branch of specialty of medicine that you want to consider. Either it's medical based, surgical based, or administrative, or whatnot. You want to go for your research or even the basic sciences one. And I'm sure it is very important to highlight that you have to balance between family life with medicine. There's no point, of course, some of my friends say that hospital is first house, your house is second house. So I would say that is not really, in a way, you have to make sure that you have to balance these things, because as you grow old, then you realize that family support is very important. So you must make sure these both things is being attended equally. So balancing family life with medicine is something which is very challenging, and you have to make sure that you go wherever for holidays or something for refreshment. So these are very important, and this is very, very crucial in terms of making yourself strong, and of course to make yourself always strong enough to face the challenges in future. And now I would like to share the problems as consultant. I have passed this time. When I was in USM, I was with USM for 20 years. And I would say that when I become a consultant, I have to take care of the medical students, my postgraduate students, my house officer, my medical officer, my junior specialists, and of course the interdepartmental issues. So it's not easy. As you go up the hierarchy, the more responsibility comes to your head. And if you're ready for this, you have to prepare whatever it is to be someone who is strong enough to manage all these issues. There will be litigations. There will be medical legal issues. Maybe the house officer have done something wrong, and your name is written at the patient's head, at the bed of the patient. The name of the consultant is your name. So you're in charge of this patient. So you are responsible with the people under you, the houseman, the first year medical officer, the second year medical officer, the third year medical officer, your registrar, your junior specialist, and of course yourself. So you have to know what is going on in the ward, what is going on in your clinics, everything. So this is not really something which is very easy. And if there is any mortality, you have to answer. You're answerable to all these things. So these are the things which I think it's very important for you to understand. So these are my previous students. So back then when I was in USM, I have to take care of like 14 students during our bedside clinical teaching. I'm sure now things have already changed. This is no social distancing. This is gone case. So in medicine now, I think the way of we are teaching, training the students already been different. So what I want to share is that there's a lot of responsibilities as you go further the hierarchy. We have a lot of debates on how many years to train medical students. If you ask, there's never been a complete or a sufficient medical curriculum to train medical students. And we need competent doctors. And of course, now, as you understand, as you can see, new diseases are coming up. During my student times, we never heard about all this COVID or about all this Ebola whatsoever. But now, as you become a doctor, you need to learn back all these various kind of things. So I'm sure there are a lot of things that is coming, a lot of new things in medicine. In fact, IT now is coming and make it very much challenging. And if you look at our neighboring country like Singapore, they are expecting medical students at year 2 or year 3 to publish papers. Back then, during my time, I would say that when I was in year 3, I published paper. Everybody was very excited to know that a year 3 medical student published a paper. But now there is nothing new about that. So publications, publishing papers is not something which is easy, which is not something which is able to be achieved if you don't have a good team to work out with. And medical legal aspects is something which is very important now, and people can easily put you in a very difficult situation when you miss a diagnosis or you mistreat a patient. So this is also another challenges that become doctors in future. And you have to balance yourself when you become a medical student. You must be involved with society work, and you must have an effective and systematic learning, and you must know how to put it in your head between the basic science that you have learned and the clinical aspect of this patient. So sometimes you don't find this in your textbook. And if you can see, sometimes like I'm a bit exaggerating if you watch House or something. Yeah, where there are certain situations in which you become like Sherlock Holmes. You have to learn from the different, you have to look at things at a different angle for you to get a diagnosis. But the end is to justify, the end will justify the means, how to get the answer of the questions on how to resolve the problem in this patient. So I already mentioned about this, the medical base, surgical base, and this was the last book that I published last time. Maybe I'm not sure whether it's in the store or not. So what I think in future, there'll be more opportunities, more specialties is coming, more clinician scientists is needed. There are now PhD qualified doctors. They are doing lab work and they're also doctors. So they do research, they train doctors, they have got clinical treating patients. So it's becoming more challenging. And of course, more and more cost of treatments as the number of patients increasing proportionately. So this is briefly to tell you how your life would be if you pursue medicine. Medical years, 5 to 7 years, housemanship 2 years, MOship 2 years, plus you already gone with the 2 years of housemanship. Then you have to decide, this is the juncture. Unfortunately, at the moment, it is either contract basis, you can be extended your MOship, or you become absorbed as a permanent post. When you be absorbed as permanent post, you're very lucky because that's the time you'll be sponsored or getting scholarships to join the postgraduate programs. So you either go locally or in overseas. And you serve as doctors in Ministry of Health Hospital, okay, and you become specialists. Specialists in government hospitals, I think on average they are getting about 8,000 a month. But when you become a subspecialist, they easily get about 12,000 a month, including some allowance. And you may consider like what I did. I went university, I become lecturer in university, becoming a trainee lecturers, and I proceed with my medical post graduate programs and serve as lecturers and also as specialists. And the grade, as you can see, is different. This is UD, this is DU. The grade is different, the numbers is different. If you're in Ministry of Health in General Hospital or in a hospital by Ministry of Health, your grade is like this, UD. But when you go to university hospital, like Hospital USM, UKM, UIA or UPM, and also UITM, your grade is DU 52. More or less, your pay is the same. There could be different by $200-300. And this is the time you become a general physician. You're just specialist. You're not subspecialist yet, and you go for another 3-4 years as subspecialist. After you completed your subspecialist, you become consultants. So this time, on average, you are earning about 15,000, 12 to 15,000, more or less the same. And this is where you become JUSA or Jawatan Utama Sektor Awam, in which if you're in Ministry of Health, they give you a free car, some other perks whatsoever. You become head department. So there are the highest pay you get if JUSA A, I think is about near 30,000. But as we go to university, you become senior lecturer, you can become professor. Professor Madya is more or less the same like a pakar perubatan, and you become professor, you can become JUSA. Most professors are JUSA. So the lowest is JUSA C, the highest is JUSA A. So this is the career pathway that you will go through if you do medicine in either Ministry of Health or in a university. So this is where I started off. I was the first batch of PKP back in 1990s. I joined it, and this is where it started off. And this is when I think last 2 years of our Raya gathering, you can see that you can see that some of our friends here, they are these are my batch. Some of them, they are coming with their kids. Not all are here. Many didn't make it. So to say that it's very interesting, and one of those days I'm sure you will have same photos as you become older. You become somebody, you'll have this. So I think that's about it. This was like last 4 years we went there, Perth. But I just want to share with you, there will be no more overseas traveling until Q3 2023. So that is what the epidemiologists are telling. Bad news, bad news. So we went to Taiping last 4 years. This is Cikgu Abdullah, this is Cikgu Aisyah. So we did some medical talks, myself and Dr. Fauziah. We give a talk about career in internal medicine. I'm sure some of them are already in medical school doing their medicine, some already engineering. I think some of them are already doctors. And I think one of them is the daughter of the Vice Chancellor now in USM. I'm sure she's doing something or engineering or something, yeah. So I think that's about it. I'm passing back to this one, Anna. The screen is yours. Thank you very much.
Thank you so much, Prof, for a very fruitful presentation. The floor is now open for Q&A session. You may write your question in the chat box. While waiting for anyone to write, I have one question, Prof.
Yeah.
So, just let's say kalau dekat masa MO tu kita tak dapat permanent position, so kita dapat contract base, ada tak cara untuk kita pursue master studies?
Okay, what is happening now, the problem is that there are limited places to train postgraduate to become specialists, and the admission to most of the time is being offered by the local university. The local university has limited space, and they only offer to those who come sponsored by the Ministry of Health to cater, because we still don't have enough specialists, unfortunately, in various areas. Like for example, for nephrology, there are only about 200 nephrologists in the country. So we are talking about now we have got 48,000 odd of dialysis patient. We're not talking about pre-dialysis as well. So the demand is so high. So when you want to do postgraduate program, the priority is given for those who are already a permanent post MO. Now you don't have that permanent post, you are contract. So even in fact you are being forced to go out to private practice. So what you have to do in such situation, most of the time, like for physician, they do MRCP, Membership or Royal College of Physicians, in which they get a Mara scholar or something, they do some loaning, so they go overseas on their own. So they try to get posts, working posts in UK, for example, to become like a servicing doctor there. It's contract basis. Every year they have to renew based on their performance, and while doing that, they pursue their training as a private doctor there, private candidate there. So there is no way you want to do it locally. So far, it's not open if you are not permanent doctors. Very unfortunate, but you have to do it in that manner.
Thank you, Prof. So, ada soalan daripada chatbot daripada Baim. Apakah kes paling mencabar yang Prof uruskan setakat ini?
Very good question. But to say that throughout my practice, I've been government I left, I think, end of 2018, 2019, I joined MSU. There's a difference between in private practice and in government. When I was in government servant, as a government doctor, the beauty is that there is no limit in terms of utilizing the facility or equipment or medication whatsoever. I just want to share, there are few occasions lah. One of the things that I can share during the outbreak of H1N1, I've gone through it few pandemics. One of it was H1N1 back in 2008, and I was a specialist in Hospital Kuala Lumpur doing my nephrology fellowship. So I have a 30-year-old lorry driver was infected with H1N1. Very unfortunate. Wife was pregnant at 36 weeks, and he was admitted into HKL, Hospital Kuala Lumpur ICU, and he requires ventilation support. It was very bad lung. One thing is that in medicine, as physician as well, you are the one who is diagnosing things. You are the leader in diagnosing the situation, and once you diagnose, you can treat accordingly. This patient was in the ICU for 2.5 months. So one thing, the difficulty is that it end up with multi-organ failure. He got a lung infection, he got cardiac failure, he got kidney failure, he got liver failure, and the good thing is that his brain is still okay. So he was on ventilatory support for like nearly 6 weeks. So we all struggle with a very minimal, because that time H1N1 was very bad. So we managed to make him back walking home. So it was a very challenging things because we got to bring in people from IGN, because HKL there is no department of cardiology. So IGN people come, infectious disease come from Sungai Buloh. So anesthesiology was there. So we nephrologists, we have to do the dialysis CRRT, continuous renal replacement treatment, for 24 hours for nearly, I think we were doing it 3 weeks direct dialysis supporting the kidney. So when you achieve the recovery is the biggest, I think you feel biggest satisfaction in yourself. So you managed to make patient go back. So it was very interesting. The second case that I had was a young lady admitted with lupus in ICU in HUSM. She was admitted there for 6 weeks. If you can Google, you type SLE, capital S, capital L, capital E, is systemic lupus erythematosus. It's an autoimmune disorder. This lady had autoimmune SLE in the brain, lupus nephritis, and the kidney. So we bang hard, we give everything. There is no limit in terms of medication, everything. Managed to get her back in 6 weeks. So she was back home after that. So it was very challenging, very interesting. But again, I tell you, I can assure you, the satisfaction can never be paid, it cannot be assessed, and tak boleh dinilai dengan mata wang ringgit. So these are a lot of other cases, a lot of cases that can be shown, but I don't think that I got time to share with you. So, but it's very interesting. But when you come to private, some patient cannot pay, the insurance claim problem, so you have to transfer. That is where you will have some issues in terms of continuing managing this patient. Yeah.
Okay, thank you, Prof. One question for Dr. Fauziah. What are the factors that cause abnormal ovarian mass?
Fauziah is here.
Okay, I just beside him actually. So what was the question? Okay.
The factors that cause abnormal ovarian mass.
Okay. First of all, you have to understand that all of us, all women, you have two ovaries, right? Right and left. I'm sure the students out there learn about reproductive. So there are quite a number of reasons or causes or risk factors that can cause the ovarian mass. So when a patient come to you, okay, complain of this abdominal pain, and sometimes patient claim of having bloatedness sometimes, and she claim or she complain of what we call this abdominal distension. Okay, so you have to ask the history of the patients, sejarah gynecology dia. Okay, so these are the things when you want to become a student or doctor during your medical schools, that you have to ask for patients' gynae history, which means all patients' gynae issues you have to ask, especially on the last menstrual period, about the menarche. Okay, how about the durations of the menses? So those are the things. So in cases of ovarian mass, we have to ask about patient's previous history, if patient has any abnormal pervaginal discharge, as an example, because some patients may presented with abnormal pervaginal discharge. So some patients may have some what we call this oral contraceptive pills. So those are the things that you have to ask to the patients when you want to come out with the reasons or causes. Some patients also may present with history of the family history of ovarian cancer, as an example. So those are the things that you have to ask about the patient's history. For your information, patients with ovarian mass not necessarily must be a cancerous, because as you understand, this tumor divided into two. It's a benign condition and also is a cancerous or malignant condition. So like these questions, you have to ask to the patients whether the patient is smoking, any what we call this, took any medications like oral contraceptive pills, whether she's married or not. So those are the things that you can ask to the patients, okay, that may cause this ovarian mass in the patients. Okay, all right.
Okay, thank you doktor. Okay,
Yeah.
satu lagi soalan. Sekejap. Okay, ni siapa-siapa pun boleh rasanya. Apakah kekurangan yang Prof ataupun doktor nampak pada graduan perubatan kini? Soalan ni panas sikit ni.
Panas. Itulah. Okay. You're talking about graduate punya quality kan? Okay, there are few things that we have to look into lah. When you talk about the quality, depends on the training, the modules. So this is always an issue. Like when I was back as lecturer in USM, there's always a challenge in terms of designing the curriculum and everything. That is our part. That is the quality or the what the university is doing to these good quality students. But again, the candidate is individual factor. That's where I mentioned to you just now about the ethics, about the discipline, and what is your intention becoming doctors. So we always have macam for postgraduate training, for pakar, there is a conjoined body. In actual fact, sebenarnya UKM, UM, UITM, UPM, USM, semua ni ada satu conjoined body yang govern pakar-pakar punya curriculum training. So memang standard. University undergraduate masih autonomous, different. Tapi masalahnya, apa yang timbul sekarang ni adalah when you don't have the good ratio between the lecturers and the student. So this is always a problem. So macam contoh bila kita buat bedside teaching, everything exposure. I have a experience last time, myself and Fauziah, we went to Prague. We have a conference there. So the 4th letters, the good students from Mara being sent to this Soviet Czech Republic. So they are good students, you know, they are 4th letters. But unfortunately, they are being sent to places where the quality of the training is very, very unfortunately not that good. Because you're talking about 300-400 people in one lecture hall and people are showing on how to examine patient. So, and then the command, the English. So these are the things that will affect you when you start practicing as doctors. So I often encounter when they become my houseman, my house officer, I have to retrain them. So that does happen. So kualiti graduan ni bermula daripada diri dia sendiri, dan Of course, universiti akan cuba yang terbaik bagi pesyarahan terbaik dan sebagainya, dan it all comes back, boils down to how you improve yourself. Itu sebabnya masih the question you asking, if you don't get a post as permanent, can I do my postgraduate? You're doing self-learning. You're trying to improve yourself. So that is a very good quality. That's a very good thing. The problem is that when you don't have inner strength, your inner motivation to improvise yourself, make yourself a quality doctor. So I think regardless whatever you're being trained, it has to become from the individual factor. Kan? So very subjective question. Yeah.
Thank you, Prof. Question from Iman. Are medical cases in Malaysia often brought to hospital when it's at a critical stage?
Okay, this is health-seeking behavior. So there's a topic in medicine, in medical school. The topic, a lecture on health-seeking behavior. The problem with our situation in Malaysians is that, you know, we are having a situation where back in 1960s, 1950s, kita percaya pada bomoh, dukun dan sebagainya. When we become modernized, in 1970s, 1980s, now we realize that medicine is, Western medicine is something that can help to cure people, so forth, you know, make things better. But unfortunately now, we are going to a situation where people talking about selling products, supplements, everything. So this makes things difficult. Just give you an example. I'm sure if you go to Facebook, you find there's a Dr. Rafida. She's a nephrologist. One of my colleagues, she always bash people who are saying taking supplements can cure the kidney, failing kidney almost immediately. So taking all these supplements, making people believe that this is a wrong thing, but it becomes the right thing for them to practice. So make them come to hospital at a very advanced later stage. So make things difficult for us to treat these people. It's not the issue of it's not really the issue of whether they believe Western medicine or not. It's the issue of they are easily being convinced by all these products. So yang itu yang jadi masalah kita sekarang ni. So you end up people coming to hospital at very advanced stage because dia dah makan macam-macam suplemen, dia dah macam-macam ubat yang dia rasa benda tu boleh membaikkan, terpengaruh dengan advertisement yang mengatakan kalau makan ubat ni hari ni besok terus baik. So these are the things that we are facing now, the problem. So yes, it is true, they come in a very critical stage, but there are some people who are being educated enough, they understand the situation, selalunya family doctors. Dia ada doktor dalam family dia. So dia rasa benda ni dia akan datang earlier. So this is something that we really have to look into lah. Yeah.
Okay, thank you, Prof. Okay, soalan lain, kalau kes pemindahan kidney dari orang lain ke pesakit, apa yang buatkan kidney tersebut tak match dengan pesakit tu?
Okay, it used to be for the last, we say 15 years ago, if for example, I give you an example, pesakit ni katalah isteri, the patient is a wife, end-stage failure needing dialysis, dia blood group A. Husband sihat nak bagi buah pinggang pada pesakit isteri dia blood group B. Pesakit yang perempuan blood group A, husband blood group B. Tak boleh berlaku pemindahan buah pinggang. Pasal different blood group. When you got different blood group, chances of rejection is very, very, very high. But for the last 5 to 7 years, different blood group boleh donate. Tak ada masalah. No rejection issue. Japan have started the first what we call as blood group incompatible transplant last 20 years. So they are the leader in this technique. So what happened now, dulu I just want to share what happened last time when I was training as nephrology. Kalau katakan pasangan ni lelaki, husband dia sakit buah pinggang, isteri sihat nak bagi buah pinggang. Another pair, wife dia yang sakit buah pinggang, husband dia yang sihat. So kita cross pasal blood group dia nak samakan. So it end up that orang ni punya wife bagi buah pinggang dia pada husband orang lain, orang ni, it becomes like that. Because we want to make sure the rejection risk is very low. So now we don't have to really do that. It can be done. And risk of rejection, thanks to the technology of transplant, ubat anti-rejection yang kita ada ni is nearly like 95% chances successful, no rejection. I would say 98% no rejection, because the regime that we are using is very, very good, and so far jarang kita dengar patient dapat rejection kecuali dia tak makan ubat, because ubat anti-rejection ni kena makan lifelong. You have to take it lifelong. You miss one day, you'll have a lot of problems, a lot of issues. Yeah.
Okay, thank you, Prof. Okay, another question. Apakah kaedah pembelajaran terbaik untuk pelajar perubatan?
Okay, I think in any courses, in any way of learning process, you kena belajar, baca, and then you cuba terangkan kat orang. So you nak terangkan kat orang, you kena ada feedback because orang akan counter balik whether what you understand, you misinterpret or you interpret it correctly. So you need someone to counter check whether you are understanding it in the right manner or not. So study group. So at least 3 people. So you read the same chapter, 3 of you, but maybe subtopics you present back. Everybody will counter check and then try to look into whether the understanding of that topic betul ataupun tidak. And of course, if there is an argument or whatever, you have to bring some evidence to support your this one. So I would say to self-motivate, to make sure that you are in the right track in interpreting things. First foremost, you must have guidance. The second thing, you must have group of people who understands and can learn each other in a very good environment manner. And I mean, moving forward, there must be a study group. Macam sekarang ni tak macam dulu. Dulu masa saya medical student, kena jumpa 3 orang bincang. Sekarang ni, we can have Zoom, you can have live whiteboard. So a lot of things you can do. So I think you must have a study group. This will be a very useful method of surviving. Yep.
Okay, thank you, Prof. Next question. Is taking traditional medicine course still relevant today?
Okay, I just want to give you an example. What is the problem with traditional medicine? It's too much of segregation. Okay, I think it's no longer, perhaps I believe it's no longer being practiced by any medical school nowadays. During our time, last 20 years, probably it still existed. Give you an example about traditional medicine. 5 years of medical student years. First year, second year, third year. 4th year baru jumpa patient. Tahun keempat baru jumpa patient. Tahun pertama, kedua, ketiga duduk dekat lecture hall, listen to theory. Just theory, pure theory. And when you learn anatomy, you have to learn everything about the nerve. I mean, you're talking about hundreds of muscle in your hand alone. You have to remember everything. And you just have to memorize things. That's what you do. And you will be supplied with one cadaver, maybe shared by 4 or 5 of your friends, and start dissecting the body. So that's what you do when you were in traditional medicine. So you just learn a segregated topic of anatomy. You belajar anatomy 3 bulan. Lepas tu bulan keempat you belajar pasal pathology, pasal microbiology, physiology contohnya, physiology, how the muscle contracts, macam mana electrical impulses, everything happen. So that's another 3 months. You tak correlate dengan yang first 3 months tu, because anatomy belajar pasal muscle je. The second 3 months baru belajar macam mana muscle ni contract. So you dah tak ingat dah yang last 3 months macam tu. So you don't really integrate. Lepas tu kuman apa yang masuk dekat tangan, apa benda yang common, belajar the third 3 months contohnya. So it's all compartmentalized. It's not integrated. So this is a very traditional way of teaching or training students, which at the moment kita dah tinggalkan dah benda ni. Dia dah kurang. Kalau you tengok banyak second year dah start tengok patient dah. So you talk more on patient. And I realise those who are from traditional school training, their communication skill kurang sikit. So this is where the problem, you see the old timer, patient doctor's communication is a little bit not really in place. So that is a big issue. Yeah.
Okay. So another question, I think this is a very interesting question. I am pursuing foundation in life sciences right now and planning to take MBBS soon. Do you think job availability will still be available for us soon?
Very good question. As you can see, as you observe, there are a lot of people now waiting for housemanship. But ironically, you see doctors drop dead, very exhausted, working on kind of this current pandemic situation. People are all exhausted, fine. But the thing that I want to say is that medicine is something which is evolving. I'm sure you have heard about artificial intelligence. So medicine would be the only field that one of those days you cannot replace it with robotics. You cannot replace it with a technology. It can assist you, but the one who is going to decide the best mode of treatment, the best modality of intervention will be doctors, the people, human. Chances of getting unemployed or waiting for housemanship is very high, agree. But we still not enough neurologists, nephrologists, neurosurgeon, obstetrician, masih tak cukup lagi. Even subspecialty, like we ourselves, nephrologists, there are like 250 of us covering a 32 million population of Malaysians. So it's not enough. And our numbers of Malaysians are increasing day by day. And people are getting older. We don't have enough geriatrics in our country. So junior doctors mungkin banyak, tapi don't stop there. You must train yourself to become specialist because that's where it's high in demand. So you have to be a bit more, apa kata orang tu, kena sabar on the first stage, tapi lepas tu always get opportunity to get yourself trained postgraduate, specialist training. Demand is there, definitely.
Okay, soalan daripada Baim. Bagaimana saya boleh pasti bahawa perubatan adalah bidang yang saya boleh carry?
Well, this is an answer that should be answered within yourself. Looking at the things that I've shown you, the track, the chart, I mean the years you will have to go through. So the answer lies within yourself. So 5 years, of course, SPM, 2 tahun or 1.5 or 2 years of A-level matrix or IB, 5 years of medical school, 2 years of housemanship, another 2 years of MOship, another 4 years of specialist training, another 3 years of subspecialty training. So those are the things ranjau you have to pass through. So if you think that you really interested with this field, you really feel that you are into it and you really want to put all your efforts on doing it, I'm sure kalau kata 50 tahun pun he or she will do it. Tapi looking at this, you have to ask yourself and you have to get information. Like this is a sharing session. I can always answer challenges in becoming physician, challenges becoming a nephrologist. Fauziah maybe can answer what challenges in obstetrics and so forth. So from there, you can see, you can predict whether you feel that this is right for you or not. So you have to get more exposure and more discussions with your seniors and colleagues. Yeah.
Okay, one more question. Does vitamin C affect the kidney function in both short and long-term period?
Sorry again. Does
vitamin C affect the kidney function in both short and long-term period?
Okay, there's been a lot of questions, debates about this vitamin C. If you take it in a small dose, adequate for your intake, of course, some people will argue you already have it in your daily intake. Vitamin, you can have it from your fruits, from the things that you're taking, daily food intake that you're doing. You can have that. But now in the era of this infection, viral infection, it has been proven that vitamin C can improve your immune system, prevents you from getting easily cold, flu, whatsoever. Taking too much of vitamin C can cause kidney stone. So it's not advisable to take too much of vitamin C, taking like more than 1 capsule a day. You're taking 2 tablets of vitamin C per day. So that's a high dose. What is being recommended is 1 tablet per day at most. So if you are already taking fruits or juices or any food containing high vitamin C, you don't need the additional supplements. But if you take both and you take high dose, long term, you end up having kidney failure because of renal stone.
Okay, question for the postgraduate study. May I know the qualification in postgraduate?
Okay. Similarly, when you go for your undergraduates medical school, you'll go for interview, viva. They will ask you a few questions. I was previously, when I was back in USM, I was also the panelist in terms of seeing, I mean, everybody, the candidates, we have only 200 places and those who are applying are thousands. So they are all, some of them are 4th letters, they are good in sports, they're good in that, everything, they are good. They have to go for an interview, viva. for us to assess whether they are qualified enough to become doctors or not, to become into medical school or not. When you go for your postgraduate training, we see your past history as well, on how you've been performing during your undergraduate years, type of students that you've been doing, any disciplinary attitude issues or whatsoever. It doesn't mean that if you don't have good results during your undergraduate years, you cannot do your postgraduate training. That's wrong. So we want to know how sure are you, how confident are you in pursuing postgraduate studies? Because in postgraduate, the issue is you are going to become specialists. Okay, you're going to become specialists. So attitude, your personality, these are the things that is very important for us to look into, not only your qualification. So, and first foremost, we will be asking you a very general question. How, let's say you want to become an obstetrician. People will be asking you, how many years have you been in the obstetrics department after your housemanship? Let's say when you do your MO-ship, you have been like 4 or 5 years in obstetrics department. So we know that you're well experienced in that sense. So experience counts. And we look back, who are the referees, the doctors who has been supervising you? What were the issues that you have gone through? And of course, we test your knowledge. We give you exam questions. You have to sit for exams, theory exams, and you'll be a viva for that as well. So there are few stages, because we are talking about dealing life, putting patient's life at risk if you give someone who is poorly trained as a specialist and you have got a poor attitude, those kind of things. It's very subjective assessment. More difficult, more thorough compared to undergraduate. That I can advise. Yeah.
Doktor, ada someone tanya, boleh tak kalau nak slides yang doktor present tu?
I can change it to the PDF. I can pass it to I know nanti.
Boleh. Doktor, one question. Wasn't vitamin C a water-soluble vitamin?
Yeah, it's true. But when you got, it can be deposited in high amount. It can promote the absorption of calcium. You can have stone. So that's the issue. So too much of vitamin C is actually not good. And I heard that some people inject it subcutaneously, which is not good. It's not healthy.
Okay, last two questions. One from me. Saya nak tanya Prof, sebab Prof cakap kita kekurangan spesialis dekat dalam negara. Tetapi kalau nak requirement untuk masuk ke postgraduate adalah dengan kena ada permanent status for MO. Do we have, do government have future plan to increase the number of MO permanent status?
I'm sure looking at the current situation, they will be considering various methods on how to increase the numbers of doctors to be into the system. One of the drawback that I believe is of course the budget, and of course you need more training places. So you need to build more hospital. So that more hospital means you can train more doctors with various specialties. And who are going to train these doctors? That also an issue. Sama juga bila kita nak train doctors undergraduate, kita kena ada cukup lecturer. Bila kita nak train pakar-pakar ni, kita kena ada yang ada sub-kepakaran. So you have to have enough numbers of sub-specialists to train specialists, or the people who is sub-specialists in that area. So it is a chain, supply chain kind of a thing, in which the people who is to train must be ready. Like for example, I can give you an example. To train a nephrologist, the ratio is 1 to 3 at most. So satu pakar perunding nephrology boleh train 3 pakar junior nephrology. So kena make sure yang satu ni is in the system. So what is worrying now, of course, what is happening, the senior most consultants sometimes after certain period of years, diorang pension, retire, and no replacement. And those who are already consultant, they left the service. They go to private. So the vacuum need to be filled. So when they fail to fill in the vacuum, they cannot accept new trainees. So this becomes an issue what is happening. Kita sekarang ni in the situation where is bottleneck. Yang junior-junior ni ramai, tapi yang bottleneck dekat atas ni tak cukup. So that is the situation that we are facing now. So again, I rasa untuk meningkatkan kemahiran diri. I rasa if you don't get your permanent post, get an opportunity to be trained overseas. Like I've got an example, my student back in USM, undergraduate, lepas housemanship, they buat MRCP membership, they go overseas, train in UK as specialist, and they get a job there. And ada juga yang buat USMLE, dia get US punya exam, entrance exam, and then work in US to become a specialist training. So various ways. You come back as a specialist, then you option whether you go private straight away or you want to work with the government.
Okay, thank you Prof. Okay, last but not least, kita nak minta kata-kata semangat daripada Prof and Dr. Fauziah for SPM students 2021.
Okay. Saya rasa biar Dr. Fauziah cakap dulu kot. Saya dah banyak cakap buat. Fauziah cakap dulu.
Kata-kata semangat Prof. Kata-kata semangat Doktor.
So dalam ni ada form 5 student. Mana raise your hands? Ramai juga kan? So ramai. Okay, saya doakan untuk anak saya yang sulung pun sekarang ni form 5 waiting for SPM. So I hope everyone yang nak exam ni kuatkan semangat ya, dengan keadaan yang ibu di rumah, mak di rumah, yang nak SPM ni di asrama, kuatkan semangat, fokus, insyaAllah apa yang kita lalui sekarang ni akan diberi keberkatan lah ya. Kena teruskan belajar, kita doakan yang terbaik lah untuk anak-anak ni semua, semoga berjaya dengan cemerlang insyaAllah. Okay, cikgu pun ada kat sana. Okay cikgu. Alright, so
okay.
Saya ingat kita pass balik dekat Prof Azreen sekejap lagi.
Prof ada nak tambah?
Sekejap lagi sampai. Okay.
Oh okay.
Alright, so saya rasa session ni memang bagus. Tahniah lah untuk ANSARA Merasim Taiping ya. Aina cikgu, sebab nampak ramai alumni ni join. I think dah minggu ke berapa dah ni, last 2 weeks ke last week. Kawan kami Dr. Arman pun ada. So tahniah lah untuk program macam ni, banyak bantu untuk anak-anak. Okay.
Okay, I think we are ending the session, right? Itulah saya doakan semua orang, kami semua doakan semua dapat berjaya dengan maksud saya dengan bagus, keputusan yang hebat. Try to do your best. I'm sure there's a long way to go. SPM is just a start. Just to tell you, SPM is just a start. There are a lot more things coming up in your future, but nothing is impossible. And please don't ever give up. Just give your very best shot. Even in fact, to be frank with you, we don't think best student can do medicine. That I can tell you. Every student can do medicine. But the quality, personality, hardworking, all these things yang kita kena jaga, ethics. Dan niat kena satu. Nak jadi macam mana. Then don't put money as your priority. That I have to tell you. Because it will come. It will come as you go along the way. InsyaAllah. And please balance yourself. Kerja-kerja, family, you must balance it. Yeah? InsyaAllah. We all hope for the best for the candidates 2021. And everyone will be successful in their life. InsyaAllah.
Okay. I would like to express my gratitude to Prof Azreen and Dr. Fauziah for being so helpful and for their willingness to become the panels for this talk. Big thanks to the audience too for being so supportive and interactive. So I really hope that adik-adik semua dapat input yang baru from this session, and I really hope that this session motivates you guys to pursue your dreams. Of course, in any field pun, besides medical field, it is not always all sunshine and rainbow. Mesti ada susah, mesti ada senang juga. So for adik-adik yang nak SPM, yang dekat Merasim Taiping sekarang, my advice as a kakak, stay focused, never give up. Focus on what motivates you, and please focus on what you need to do to achieve all of your dreams. Okay, insyaAllah. study ni memang is not an easy path, okay, but it is for sure totally rewarding. So inshallah again big thanks to amazing couple Prof Azreen and Dr. Fauziah. We really hope that we can work with you again in the future inshallah. Boleh ke Prof, Doktor?
Okay.
Boleh ya?
InsyaAllah.
InsyaAllah, okay.
Definitely.
And the rest.
Okay, thank you everyone. Stay safe, stay home. Assalamualaikum and have a good night.
Thank you.
Dr. Azreen. Thank you, Dr. Fauziah. Thank you so
Thank you.
much. Lama betul tak jumpa.
Alhamdulillah. Terima kasih banyak cikgu.
Terima kasih juga. Ya Allah. Betul-betul budak-budak SPM ni memang sedang berperang.
InsyaAllah lah tahun ni, tahun lepas
COVID.
kan.
Yelah.
Mudah-mudahan yang terbaik lah untuk semua.
Itulah, mudah-mudahan. Kan, tahan sikit lagi.
Sebulan lagi. Bulan 2.
Itulah. Thank you so much doktor. Berdua. Thank you so much. Bukan senang dapat baca ni. Thank you so much. Okay. Alright. Okay doktor.
Thank you
Thank you.
everyone.
Thank
Bye.
you.
Assalamualaikum.
Salam.
Okay.